Greetings from Umai Clinic. I'm Dr. Arulmozhi Varman, Medical Director of Umai Clinic, Anna Nagar, Chennai. In this podcast, I'll be talking to you about glaucoma. That's a term that most of us would have heard about. Glaucoma means the pressure in the eye that goes up. The eye is a fluid-filled structure. Just like we have got pressure in our blood vessels, which we call as BP, there is a pressure in the eye. If this pressure goes up, that can affect the eye nerves, that's the optic nerve and the retina, and that can eventually lead to blindness. Now, what causes the pressure to go up? A lot of people think just like BP, tension, worry, having coffee, cigarettes and all those kind of activities can increase the eye pressure. No. All of that can increase BP, and doing some exercise and reducing weight can bring down BP. The eye pressure is independent of all this. The eye pressure going up isn't disease by itself. Most people have this kind of a pressure going up as a disease, usually at the age of 40 or above. Rarely, this kind of glaucoma can be seen even in newborn children, though it is pretty rare. Pressure going up, what does it cause? The eye pressure causes the nerve inside the eye, both the retina and the optic nerve, to dysfunction, and slowly vision is lost. 90% of the time, this whole process is painless and nobody knows anything about it until the vision is very advanced, loss of vision occurs. That is why we call glaucoma as a silent thief of vision, because there is no signs and symptoms. Glaucoma has to be diagnosed early. That is the most important thing. How can you diagnose glaucoma early if there are no symptoms? Everybody should undergo an eye test every year, particularly if you're more than 35 or 40 years old. Because that is the most crucial years when diseases such as glaucoma or diabetes or cataract can come. A routine test by the ophthalmologist, where they look at your pressure as a routine, not only vision, they also look at the retina and the optic nerve, and at very early stage, glaucoma can be diagnosed before any defect in vision is caused. Whichever stage we diagnose glaucoma, we can control it. If vision is lost, unfortunately, by controlling the pressure, we cannot get back the vision. So it is very important for glaucoma to be diagnosed early. Then brings us to the next thing. What is the treatment for glaucoma? There are several eye drops which can be used once a day, in some instances twice a day, very rarely 3 times a day eye drops, which can bring down the pressure. Whether you're using the eye drops or any other method of treatment, follow-up is very, very, very important. Every year, the patient should come back and test the eyes thoroughly and make sure that everything is under control. Drops is one, as I told you. The other option is lasers. There are some lasers that can be used which will bring down the pressure. This pressure that can be brought down may be permanent, or it can be brought down for 2 or 3 years, and every 3 to 4 years the laser can be repeated. This is known as selective laser trabeculoplasty. It gives an immense advantage to the patients that they need not keep on applying drops every day. In some people, where the laser doesn't work as well as the drops don't work, we can resort to surgery. Surgically, we can bring the pressure down. So there are 3 choices: drops, laser, or surgery. Today, in the modern treatment methodologies, the laser is taken as the first choice. If laser is not working in some people, then we put them on drops. If the drops doesn't work, then we take them for surgery. So number of people going for surgery in the last 10 to 20 years has come down tremendously because of the excellent results that we get with laser as well as with the drops. Again, underlying philosophy about glaucoma. It has to be diagnosed early before any vision problem is there. You have to get it diagnosed by seeing an eye doctor on a regular basis and getting your eye tested. Testing your eye for vision and wearing glasses is not a full test. That only an eye doctor can do a total test which will look at your eye nerve and the pressure and diagnose the glaucoma very, very early. So make sure that the diagnosis is made. If a person has got glaucoma, they should go to the doctor very regularly, once in a year or sometimes twice a year, to get it corrected, or to maintain the vision and maintain the treatment protocols. Another important thing is glaucoma is inherited. It runs in families. So if somebody in your family has glaucoma, it is best everybody in the family get tested and continue to get tested every year, because the chance of getting glaucoma is very high. It is inherited genetically. Keep these things in mind and save your vision from this sight-threatening disease known as glaucoma.